Epidural anesthesia. Introduction. It is normal to feel pain during an epidural injection, and you should not tell your doctor about it.
Select true or false.
Correct. Pain suggests that the needle may be touching a nerve. Always tell your doctor if you feel pain, particularly pain in the legs. Allergic and other drug reactions are rare.
Select true or false.
Correct. Even though these reactions are rare, they can still occur. Any personal or family history of drug allergies or other reactions should be discussed with your doctors. Moreover, you should inform your doctors about the current medications you are on. Some of these medications may need to be stopped days before the surgery to prevent excessive bleeding. Such medications include, but are not limited to, aspirin or Advil. Heart attacks, strokes, and death never occur during or after epidural or general anesthesia.
Select true or false.
Correct. Even though these complications are rare, they are still possible, especially if the patient has a history of heart or lung disease or strokes. Blood clots in the legs after an operation are harmless.
Select true or false.
Correct. Blood clots in the legs are very dangerous. Even though they are unlikely to happen, they can cause death. The symptoms may include swelling of the leg, shortness of breath, and chest pain. Very rarely, a blood clot can go to the lungs and cause death without giving any other symptom. It is common to have nerve damage from compression and blindness after epidural or general anesthesia.
Select true or false.
Correct. These risks are very rare, but in spite of the best precautions, they may still happen. You should ignore any infections at the IV site.
Select true or false.
Correct. You should not ignore this complication. The earlier it is detected, the easier it is to be treated. Headaches, fever, and leg weakness are normal after such anesthesia.
Select true or false.
Correct. These are the signs of possibly serious but rare complications, such as fluid leak, paralysis of the legs, loss of bladder control, or infections around the nerve and the brain. If left untreated, some of these complications can cause death. It is therefore very important to report these symptoms to your doctors. Rarely, teeth can be damaged when the tooth is placed in the throat.
Select true or false.
Correct. This happens very rarely. To try to prevent this, you should let your anesthesiologist know if you have any dental work, such as bridges. It is impossible to get infected through blood transfusions.
Select true or false.
Correct. Infections after blood transfusions are very rare but possible. It is also possible to contract diseases that are not discovered yet. Thank you for using Explain.